Hi guys, hi Bladder Relief Group. It's really nice to be with you again. This is our second week, and I'm going to try and do these live meetings kind of every week. Right now, it'll be every Wednesday at noon. That seems to be a good time. And if you guys can join us live, I would love to have interaction with you, to have dialogue with you. If you guys have any questions, you can feel free to type those. And so we're just getting started. We're going to keep growing this group. I love the interaction that I've seen so far. As I read some of your all stories, it makes me sad because I know how terrible that this condition can be. So last time we talked about overactive bladder, and it was more of an introduction. What is it? We talked about urgency, frequency, nighttime urination, and then we talked about incontinence. It really can be any of those things, but that's kind of what makes up the cluster of overactive bladder. And then you guys might remember we talked about what the number one cause is for overactive bladder, or I should say it differently, what the root cause is. Like, why do people actually get that condition? And what we know now is that it's a nerve transmission problem. So the nerves from your bladder to your brain aren't working as well. They're not conducting as well. And we see this with all kinds of other medical problems too. So like chronic pain would be a good example of this. We know that things like diabetes affect the nerves, thyroid problems, wear and tear as we age. All of those things affect the nerves. And so overactive bladder, because these nerves are so sensitive, over time, these nerves actually degrade faster, and then we start running into some of the problems that we call overactive bladder. Today, we're going to have what I think will be a really interesting conversation, and my suspicion is most of you guys have never heard this information. So I know that when I started researching this, started studying this, I was kind of blown away, to be honest with you, with some of the stuff that I was reading, the side effects from the medicines, how well that medicines actually work. So we're going to talk about each one of those things. If you guys have questions, I would love to see those in the comments or jump in now and ask questions. The first thing with any kind of medicine, we always start to wonder, one, is it safe? And then two, is it effective? So we're going to talk about those things. Loosely, there are kind of two classes of medications that people take for overactive bladder. And you could divide them into the older class and the newer class. The older class of medicines, those have been around for a long, long time, and those are called anticholinergics. And essentially, they block acetylcholine, one of the receptors, at a receptor in the body, and they go and bind in the bladder wall along that muscle, and they prevent the muscle from contracting. So really, what they end up doing is they end up being an antispasmodic. So instead of the bladder spasming all the time, the idea was if we can prevent it from spasming all the time, then maybe that'll really help people with overactive bladder symptoms, because you won't get the spasm at night, waking you up to go to the bathroom at night or all throughout the day. And so I think that's good rationale. Although I will say one of the big problems that we've had with those medicines is they don't focus just right on the bladder. They go all to the rest of the body. And so that class of medicines, you may have heard of some of these medicines, but like ditropan or oxybutynin would be the most common one. Detrol is a common one. Trosac, Vesicare, Toviaz. Oxybutynin you can get as an oral medication. They also have a patch that you can actually buy over the counter at Walgreens or Walmart. You can buy that over the counter, and it's a patch that you apply at nighttime. So those medicines, remember, anticholinergics, we call them dirty because they do all kinds of things across the body. They're not just focused right on the bladder itself. And so the first thing we'll look at before we talk about like side effects, we'll talk about efficacy. And so one of the best things we have in medicine, and you can ask your doctor this, and a lot of doctors just, unfortunately, we're not trained very well to understand research and understand how well medications actually work for different conditions. But there is something called number needed to treat. And essentially that means if, you came to me as a doctor and you say, I have overactive bladder, and I write a prescription. How many prescriptions do I have to write for how many people before one person does really good with that medicine? And so there are certain conditions, like you can think of like strep throat. Probably most of us have had that. Our kids may have had that. I remember having that in college during breaks. But if your doctor prescribes antibiotic for strep throat, the number needed to treat is close to 1. That means that if he writes that prescription for me and I have strep throat, most likely that medicine is really going to work on helping me where I don't end up in the hospital and it actually kills the bacteria causing the problem for me. Now, obviously, antibiotics can have all kinds of other side effects and problems, but in this specific example, strep throat, the number needed to treat there is very close to 1. So, it might be 0.9, so it means, it might be like 1.2. So he'd have to write the prescription out for just a little bit more than one person for it to work. All that is an example for the bladder medicines. Let's say that I had 8 people come to me and I wanted to prescribe that ditropan and oxybutynin. It's the same medicine. If I prescribe all 8 of those people a prescription, most likely one of them would get a benefit. And so the number needed to treat is 8. So what that means is this medicine does not work for 7 out of 8 people. And so it also means it's not a terribly efficacious medicine. It's not a medicine that's going to help most people. And you could go right down the list. So I mentioned ditropan, number needed to treat 8. Toviaz, number needed to treat 8. Detrol, number needed to treat 12. You have to treat 12 people. Trosec, number needed to treat 9. Vesicare, number needed to treat 9. So those are kind of the most popular older class of bladder medications. Those medications are generic. And so those medications, generally can be purchased cheaper. So now let's talk about side effects, safety profile. And this is where I think the talk gets I think that's interesting, just the fact that the medicines are rarely effective for people. And that, remember, is number needed to treat. But let's look at side effect profile, because that's really important. If you're on a medication, you want to know, is it going to cause other side effects? Well, that's one of the big problems with this class of medicines for overactive bladder. The biggest problem, this is the one that scares me, is it drastically looks like it increases the risk of your of getting dementia. If you already have dementia or some cognitive decline, then these are definitely a class of medications that you would want to stay away from. But honestly, I feel like for almost everybody, I wouldn't want my family members or myself to take this medicine. Looks like it increases your risk of getting dementia by about 150%. And one of the really, really scary things, at least in my mind, is we think 10% or more of the dementia in the Western world, so that would be like Canada, America, the European nations, 10% of the dementia that we have, and we know dementia is a really big problem, 10% is likely from these medications. And that is actually extremely scary. That means the person probably would not have gotten dementia unless they had been on this medicine. So that's the number one reason why you probably want to avoid these medications. The number 2 reason is they drastically increase your risk of falling. And because of that, falling / fractures. So that might be falling, breaking your arm, breaking your hip, getting an ankle fracture, whatever it is. But as we get to be 65 years of age or older, fractures become actually one of the most dangerous things that we can encounter in our lives, and they actually end up being a real killer for people. And so that's really something that you want to avoid, as falling and fracturing. I think for all of us that makes a lot of sense. But they increase your risk of falling and getting fractures by around 300%. And again, if you weren't on the medicine, you wouldn't have the risk. Why do they do that? Why do they increase the risk of falling? Well, they do a lot of different things, but some of the things they do is they make you feel dizzy, confused. People can have hallucinations, You can feel tired or drowsy, brain fog, blurred vision. So you can imagine waking up at nighttime, you feel like you have to go to the bathroom, you're stumbling across things, boom, you have a fall and get a fracture. It could have been from one of these medications, and that could be a significant risk for mortality for you. Blurred vision, racing heart rate that increase your blood pressure, constipation, and then bladder retention where your bladder's not actually letting you go to the bathroom. So that is the side effect profile for the older class of medications. These are the ones that most people, I would say, are on if you're on one of these medications. There have been some really big research studies, and so one of the research studies looks at over 42,000 people, and it looks at when these people start this medication, and it follows them over time. And I want you to guess what happens. And you might already guess it. So those people are going to come off the medicine. And why are they going to come off of it? Well, for one, it doesn't work all that well. It only works for 1 out of 8 people, and that's the best of them. Likely it's less than that if you're on any of the other ones. For 2, it has a ton of side effects that are really terrible side effects. So that's what the studies basically show. This is a huge study looking at over 42,000 people, and more than 85% of people quit those medications because they don't work and they have a lot of side effects. Now let's look at the newer class of medications. So those newer class, there's 2 of them, Myrbetriq and Gemtesa. And so those ones are actually more, they're not as dirty of a drugs, they're more specific for bladder problems. And they actually work on something called a beta-3 agonist. And there's a real common class of medicine called beta blockers. Those are for heart, they decrease your heart rate and they affect, this is a different beta one that mostly is in the bladder. Now let's look at, okay, so a couple things. We want to, again, look at, are they safe and are they effective? And then the other one for this one is they actually end up being really expensive. They're not generic. First thing we'll look at is, like we looked before, let's look at the number needed to treat. So the number needed to treat, even though these are new, there's a ton of research. There's actually commercials on TV. They have a cute little bladder guy. That's their spokesperson. Their number needed to treat is 9. So they're actually, I'd have to treat 9 people before one person does good with this class of medicine. And for some people, these medicines will be a couple $100 a month, and for some people, they're like $1,000 a month. So they actually become extremely expensive for people. Okay, so that's, maybe they're not all that effective for most people. But what does the research say? And this is, this surprises me a little bit, but we'll just look at Myrbetriq. It's actually been out a little bit longer, and it's had a couple research studies. For urinary incontinence, Myrbetriq, even though it might be a couple $100 to $1,000 a month, it's 8% better than placebo. So, that, I guess if you're part of that 8%, that could be a good thing for you. But for most people, that's not a huge difference. It's not a huge difference, instead of having all these, incontinent episodes, now you have 8% less than someone who just took a placebo pill. Let's look at frequency. That's another problem. Waking up at nighttime frequently, going to the bathroom, or frequently during the day. It's actually 5% better than placebo. So yeah, there is some effect, but that effect is probably very, very minimal. And again, these are the newest, best, and brightest classes of medications that there are. They do cause side effects for people. They have less bad side effects than the other class of medicines. But some of the bad ones are they can increase your blood pressure. They can give you headaches. Stuffy nose is common. And then they can cause heart arrhythmia. And of course, none of those are good side effects. Okay, so those are the medications for overactive bladder. And again, that's the most common medicines, are the older medicines, the anticholinergics. And it's the newer class of medicines, the beta-3 agonists. Both of those are not terribly good. They're not good solutions for overactive bladder for the vast majority of people. And, in my practice, that's one of the things I want to try and do is, really get people off of, you should be on as few medicines as you need. So just beyond the medicines that you need, don't take any more than that. But we want to get people off of these medicines because long term, they're not great for you. Let's look at another medicine, but this one is injected into the bladder. I think a lot of you guys have heard of this. I think some of you guys have tried it. I saw in some of the comments. Botox injections for overactive bladder. So just to back up a second, Botox is a neurotoxin, and it's botulinum toxin. I remember, I think my mom talking about botulinum toxin from canned foods. Botox obviously has been out for a while. For most people, it actually is safe. As you can imagine, it's injected into the bladder in 20 different spots for most people. The idea is to prevent spasms. Okay, let's see. I'm just looking if there is some questions. Okay, perfect. I do have one question before I jump into Botox. Wonderful question. Okay, and maybe that's two questions. Number one, does Medicare pay for the InterStim device? I'm going to talk about that on our next live that we have, but the short answer is yes. And then the longer answer is there is another technology that I think is actually better than InterStim, the one that we focus on, called Axonics, and I'm going to talk all about it, tell you guys all about it. I'm going to give you a little teaser at the end of this, telling you about that. The other question, do the dementia symptoms reverse if I were to stop those medications? Wonderful, wonderful question. The short answer is likely we don't know the long-term effect of these, how long the effects of these medications last. And then I think the moderate answer is, likely you should stop the medication. I would not have myself or any loved ones on those medications for any length of time at all. I've had a few patients who are like, hey, I'm traveling and I want to take this medicine while I'm on vacation. It's like, okay, for a couple days or for a week, you're probably fine. But the less that you're on those medicines, I would say the better for you. I am going to talk about some natural supplements that I recommend, and so we'll talk about those at the end. If you guys have more questions, keep them coming. Those are fantastic questions. And I would say I didn't answer that question probably the best way. Can it be reversed? I think the short answer is yes, it likely can be reversed. There might be some things that you need to do that are dietary things, and then are maybe some of the natural supplement things. But I think your body will clear that out, and likely you can have some of those things reversed. So I think that's a wonderful question. Okay, so Botox injections into the bladder itself to prevent spasm. Again, this makes perfect sense. Injecting the Botox neurotoxin into the bladder muscle in 20 different spots will prevent it from getting irritated and from spasming. But remember, we said overactive bladder is from the nerves actually not conducting very well. So from that standpoint, maybe it just doesn't quite make sense for overactive bladder, but from spasticity standpoint, it does. What the research has kind of shown on this is it has about the same efficacy as medicines. So it's not a medicine, and I think that's actually maybe a reason that you would do this if these were your two options. At least you don't have the side effects of medicines. What I've seen is, and what the research shows, is initially there's about a 50 to 60% improvement in your symptoms. So it's not 100% improvement, but 50 to 60% of people will see some improvements in their symptoms. Unfortunately, what begins to happen is that begins to fade over time. So if you're in that 50 to 60% where you have some success after getting Botox, oftentimes you'll need another Botox treatment. What's usually recommended is about 6 months to a year. The Botox itself really relaxes the muscle for about 3 months. But as you begin to have more of those Botox injections, let's say you have it again 6 months later or 6 months later, they begin to wane in their effectiveness. And for most people, it's less and less effective. And that's what the research basically shows. Even the people where it's highly successful at the very beginning, long term, only 25% of those people are receiving benefit. And there might be a lot of reasons for that. I think one is you have to do it frequently. Every 6 months ends up being a lot. Two is our body is really smart, and our body makes antibodies to this toxin. And so once our body sees this toxin, it'll make antibodies and it'll stop working. The same thing happens when people inject Botox in their face. After a while, they don't get the same benefit that they had before. So I think Botox, might be better than medications, certainly, because it doesn't have as many systemic side effects. But I think long term, it's probably not the answer for overactive bladder. I'd love to hear your all's comments. Did it work for you? How long did it work, and are you still doing it? Okay, let's see. Okay, so one comment: Botox was awful, and it caused many problems. Okay, I'm so glad that you brought that up, Rebecca. One of the things I did not talk about is Botox actually has some pretty bad problems that it can cause. The most common problem is urinary retention. And remember, our bladder is supposed to contract, and that's how we pee out fluid. If it's not contracting normally, or if it kind of stops contracting, we call that urinary retention. The bladder just stays full and it doesn't actually empty out. And that can become a medical emergency. And so that is one of, I would say, the significant risks with Botox injections. Is it's actually a fairly high percentage of people, and it depends on the studies you read, but up to 20% of people will have urinary retention and have to catheterize themselves just to release the urine. Oftentimes that'll go away, but for some people, I don't think that usually is a long-term thing. But that's a terrible experience, and I wouldn't want anyone to have to go through that. So I think that is one of the common side effects from Botox, and obviously for a lot of people it doesn't work. For about half the people it doesn't work. Let's look at natural supplements. Okay, and then I'm going to end on a high note because a lot of this has not been all that high. It's just like, okay, here's the bad news. This stuff doesn't really work. Natural supplements. So there is some research. I'm going to give you 3 that I kind of recommend for most people, and you can do your own research. But there is pretty good research for vitamin D3, and you can buy it from Amazon. D3 mixed with K2, which is another vitamin. Vitamin D3, you guys probably remember from COVID how important vitamin D was and how it boosts your immune system, but also works on 2,000 other different interactions in the body. And basically a lot of health revolves around high vitamin D levels. And I should say high normal vitamin D levels. And COVID was a great example where people who had low vitamin D levels were the people generally who were getting very, very sick and who were dying. And that's something that all of us should have been doing, is kind of supplementing with that. Vitamin D3 levels, there has actually been some research on this supporting people with overactive bladder. So that's an easy thing for you to take. It's not expensive. Most people will recommend around 5,000 international or IU units per day. That's what I take myself. K2, you can get them where it says vitamin D3 and K2. So just find it on Amazon and you can buy that. K2 preferentially puts calcium into your bones, and that's something none of us want: osteopenia, osteoporosis. But we don't want calcium to form in our blood vessels. And so this is a little bit of an aside, but you should look, if you're taking some kind of supplement that has calcium, you should probably stop it. There's a lot of research now saying we should not take calcium as a supplement because it increases our risk. Because it causes stones or calcium deposits, it increases your risk of things like heart disease, heart attacks, strokes. So it actually increases your risk of dying early. So look at your supplement. Usually it's one of the supplements that you shouldn't take calcium by itself. Even if you have bone problems, likely vitamin D3 and K2 are what you should be taking. Okay. Magnesium is number 2. So magnesium is a natural muscle relaxant. And that is actually given to some people IV for before certain surgeries and certain things like that. But that's something that 60 to 70% of all Americans are deficient in magnesium. And it's because It's normally in our soil, but because of how we do crop rotations and we don't do crop rotations, our soil is magnesium depleted. So magnesium at nighttime, it should help the mind to relax. It relaxes muscles, so it should help your bladder to relax. It's a natural version of those other things we talked about. 400 milligrams at nighttime is what most people will recommend. So 400 to 500 depending on your weight and all that kind of stuff. But I would say 400 is a good place to start. And so that would be a great thing for you to start taking at nighttime, and you can, again, do your own research and figure out if you think it's right for you. The third supplement that I'm going to recommend is, and remember, all of what we think this overactive bladder is a nerve problem. So I'm going to recommend a B complex, vitamin B complex. And so we know a lot of people are deficient in vitamin B. Certain conditions, alcohol use, other things can decrease our vitamin B levels and actually lead to nerve damage. We're trying to restore those nerves. And so vitamin B complex. The best one personally that I think that I use myself is called Thorne. You can buy it on Amazon, Thorne. And the reason I like it is because it's built in such a way that everyone's body can metabolize it. Some of the other ones are not like that, and so you may not be getting the real benefit. So that's the one that I recommend. So today, I'm going to end on a high note, but today we talked about bladder medications. Are they safe and effective? I think you guys can make your own decision on that. We talked about Botox into the bladder injections. Is that safe and effective? Is that something that you should do or continue to do? And then we talked about natural supplements that everyone should look at, and you might think about taking one of those just to support the overall health of your body, but also your bladder. If there's any other questions, I would love to answer those. I'm going to end on a high note. We had the question of what's called sacral neuromodulation, and that's what I specialize in. The question was about InterStim. That's one of the companies. And so there's two phases to sacral neuromodulation, but the first phase is to do a trial and see if it works for your body. It's very simple to do. It takes about 10 to 15 minutes usually. And so every day I get these little updates on how the people are doing that, we've just done it on. And so they're fun to read. So I'm just going to read you some of them. Of course, I'm not going to read their names. This person is doing 75% better. Urgency is down to a 1. We rank urgency from 1 to 4. 4 is like an emergency. I have to go right now. If I don't go, I'm going to have an accident. So her urgency is normal. Intervals are up to 3 hours. Now she's going every 3 hours before she has to go to the bathroom. Leaks down to 2, and pads down to 2. So instead of leaking 6 times a day, 8 times a day, now it's 2. No more stool leakage. And so we haven't really talked about this in the bladder group, but this similar technology works for both bladder and for fecal incontinence. Okay, here's somebody else. She states 50% improvement so far. Her intervals are up to 2 hours. Her urgency is down to a 2 out of 4. Remember, 4 is like an emergency. Her pad changes have decreased in half. Here's a gentleman with fecal incontinence. Admits to no accidents, no messes, no diaper changes. He was able to get to the restroom on time. He's very happy, 100% relief. And then here's the last one I'm going to read to you. No more nighttime voids. No more. Okay, so this person's not waking up at nighttime anymore to go to the bathroom. That's a huge deal. No more urgency. Leaks or pad change. If this person's not having any leaks, not getting up at night, no more fecal issues, incontinence either. So this person was having bladder and fecal, very common. She's extremely happy, 100% relief. So that's kind of the stuff that I read every day, and that's what we're going to talk about next time. Now let me see. Also B complex. How many units of the B3 plus K2? Okay, so I'm going to answer those questions. How many units of the B3 plus K2 do you recommend? Okay, so when you buy the vitamin D3 supplement, it'll have K2 mixed in it. You don't have to worry about the dose that's in there. There are some people who are starting to recommend a higher dose of K2, but really that's more for people who have osteopenia and osteoporosis. I don't think it's a bad thing to take an additional one, but if you buy a vitamin D3 that has K2, then you should be okay. And then the B complex, also B complex. B, how many units of the B3 plus? Okay. So the B complex, it actually has the various different formats of vitamin B, B1, B6, B12, which give you energy, restore nerve function, all of those things. But it has them all mixed in, so you actually don't have to worry. And again, if you look at the Thorn brand that I recommended, I take that one of those every day, and I think that's all that you need to take. And I don't think there's, there might be some very select groups where if you actually measure your B vitamin status and it's low, maybe you would take a little bit more, but I think that's more far and few in between. All right, guys. Well, I think that's all for today. I look forward to next week. Next week, I'm going to talk about, so far we talked all about what overactive bladder is and some of the common treatments. Next week, we're going to talk a lot about sacral neuromodulation. And then I think we'll talk a little bit about some of the other treatments as well. And if you guys have questions, I would love to hear those questions. If you have more questions about what we talked about today, I would love to hear that too. I hope you guys have a wonderful week. God bless you guys, and thank you so much. Any other questions? No? Okay, perfect. All right, thank you guys. We'll see you. And remember, next week, noon on Wednesday, we're going to do it again. Thanks so much.